Hi, and welcome to our Ask an Expert series supported by the Chicago Asthma Consortium. My name is Dr. Sharmili Nienhuis, and I'm an associate professor at the University of Chicago. And I'm also the co-chair for the Community Engagement Committee of the Chicago Asthma Consortium. Today, we're bringing you an Ask the Expert series on tenants with asthma assessing a home. This is also being brought to you in part by the Metropolitan Tenants Organization. Today, we have two wonderful community health workers from the Sinai Urban Health Institute who will be walking through a home with us and telling us and showing us areas that may trigger your asthma in the home. So first of all, I'd like our community health workers to introduce themselves. First of all, Kim J, could you please introduce yourself?
Hello, my name is Kim J. I'm a senior community health worker with Sinai Urban Health Institute. Have been a community health worker for the past 10 and a half years with a focus in asthma and COPD.
Great, thank you for joining us today. And Madeline Woodbury?
Hi, my name is Madeline Woodbury. I'm a community health worker for the Sinai Urban Health Institute, and I have been a community health worker for 8 years now and working with asthma.
Wonderful, we're so excited to have you join us today. So today we're going to start off with a case study of a patient that maybe Kim and Madeline have encountered, an example of a case that maybe Madeline and Kim have encountered in the past. So Jennifer is a mother of two boys, ages 7 and 9. Jennifer was diagnosed with asthma as a child, and her two boys also have asthma. They moved into their current home about 3 months ago. All three are using their medications as prescribed, and their inhaler technique is great. Despite this, the boys have missed over 10 days of school over the past 2 months due to their asthma symptoms not being controlled. And Jennifer has had to miss work for her asthma symptoms and also caring for her children. Jennifer is wondering if there's anything about where they live that could be triggering their asthma symptoms. So let us, so as a community health worker, often you guys are going into the homes of these patients and of these families, and these are kind of maybe some pictures of things that you see. So first you enter Jennifer's home. And here you notice in the doorway, first there's some gaps between the door and the molding. And you also see that maybe the thresholds is waterlogged. So Kim, what sort of things do you think about when you may see this in the entryway of the home, and what things might be, contributing to their uncontrolled asthma symptoms?
Thank you, Dr. Shamili, for that question. So if I would walk into a home and see something like this, the first thing that comes to mind for me is mold. Mold is a trigger for asthma, and if it's mold of this nature, it's going to be pretty severe because it is when they walk into the door and every time they walk across it, it sort of disrupts those mold spores and they get into the air. So that definitely does trigger that asthma reaction. When you think about all of the gaps between the doors, you think about the moisture that continuously comes through. So even if they were to address what's happening on at the doorway with the mold that's you're seeing right now, they will still have to address those gaps to prevent that water and that moisture from continuously coming in the house. And in the wintertime, if there is a breeze that comes in that's cold weather, that can also be a trigger for asthma, not to mention the carpeting also that is at that door, because that's going to hold all those triggers, all that mold, all that dust, and every time they walk through the threshold, they disturb it, kick it up in the air, breathe it in, and it causes those asthma exacerbations.
Great, thank you so much. Now we get through the entryway and start walking into the living room area. And Madeline, this is what you see. You see a carpet that looks like either it has a stain or maybe some mold, maybe it's a mold stain, maybe it's some other sort of stain, and you see an ashtray in the living room. So what are some of the things that you're thinking about here?
Well, to look at the molded carpet, as Kim said in the previous slide, walking in, we don't know whether that is wasted, but it's still maybe mold spores that's in, and they continue to walk on it. And when you have a stain like this and it's been previously wet, I know that it's an odor, and odors is also a trigger to asthma. So we're still walking around, walking over the spot and spreading mold all through the house. Now, the second picture, the tobacco smoke, is one of the worst triggers that we could have for asthma because the cigarette smoke is very dangerous, any type of smoke. I know that we're talking about the tobacco, but any type of smoking activities that's taking place into the home, it could be a really bad trigger for asthma. And if there's someone or a whole family in the house with asthma, there should not be any type of smoking inside of the house. That's very dangerous.
I'm glad you
Yeah,
brought that up as far as not only tobacco smoke, but other sources of smoke. Go ahead, Kim.
just wanted to add, and now that the cigarettes are just sitting in that ashtray, that scent is just lingering and becoming more toxic in the house. Oftentimes, we don't want people to smoke in the house. Really, that's ideal, but realistically, we know it's not going to happen overnight. It's going to be a journey to that. But we encourage patients who are even doing this to not let old cigarette butts sit in an ashtray because that smell becomes more and more toxic and more of a trigger for asthma. Thanks.
Okay, great. So also in the living room, we see some vents that look like this. So Kim, do you have any anything that you'd like to point out here?
Actually, yes. The vents are, first of all, I see the dust that's covering the vents. And then when you take a deeper look, you see there's also mold as well. This just tells me there is a moisture issue going on in this entire apartment, and there needs to be some really, really heavy duty work done to address all these areas. Now, in the wintertime and in the summertime, again, that same unit is used to blow heat or to blow air. And this also distributes these mold spores throughout the house. And as they float in the atmosphere, you breathe these in, they begin to trigger your asthma. Some of the mold spores can be a little bit more controversial because they can almost embed your asthma walls and cause scarring there with the mold. So it's very important that when you see the dust accumulating, not only that you clean it, but you want to sanitize those areas too. But when it comes to the severity of the mold that exists in here, there needs to be something addressed for the landlord because you cannot take this unit apart. It has to be handled by management.
Okay, great, thank you. Okay, so now we're through the living room and we're gonna head to the kitchen. And here we, oops, I think we might have missed one, sorry. So first of all, on the kitchen, and sorry that if this picture isn't clear, you definitely see some food and food items are left out and open. So Madeline, what are some of the things that you might be concerned about here?
With these items that's left out, if they're left out too long, it's odor. And a lot of people don't realize that odor is a big trigger for asthma. The oils, the different oils that sit up, it's very dangerous. These things should be kept up and kept closed and kept in refrigerated, refrigerated if needed. So it's a lot that's going on right here. And the odor, I think odor would be one of the main triggers.
Okay, great. And Madeline, there's also, as you're starting to look under the sink, which not everyone always looks under, but you look under the sink, you see some mold under this kitchen sink and even some mold around the kitchen cabinets. And I know we've already talked a little bit about mold, but maybe we could also talk about, because the second picture shows maybe somebody trying to clean it. So what kinds of things, you know, do you maybe even want to think about when even cleaning, you know, concerns about cleaning agents to clean up mold?
Well, a lot of people would try to take bleach to get rid of the mold, and bleach is not the proper way to do it. Vinegar is the best way to do it if you don't have a certain paint. But they could take the vinegar and mix vinegar and water and spray it down and continue to do this, repeat this as necessary in order to get rid of the mold.
Okay, great.
Me-
Oh, go ahead, Kim. Were you going to add something?
No, I just wanted to add that when it comes down to handling mold and addressing it, for those who have asthma, it's not ideal for them to do this themselves or not unmasked. Also, it's important to know that people do apply bleach to address some mold issues, but for asthma patient, the ideal way to address it would be to use the vinegar and water solution that Madeline mentioned, because again, um, bleach is a way to address it, but not the ideal way for those who have asthma.
Great, thank you. And Kim, you also see maybe some of these little black dots, you know, scattered around the kitchen. So, you know, we kind of show here that, you know, that could be representative of cockroaches. So maybe tell us why, obviously cockroaches aren't great to have in the home, but how that might even trigger asthma.
Nobody wants a roach as a housemate. Number one. Number two, roaches pee, they poop, they shed their skin. These allergens are around the home. Whatever they crawl across becomes contaminated. And as you touch to your mouth or nose, you're again breathing in these allergens. They are can be so severe that you see it in a representation that you're looking at the picture on the right side of your screen. This is their poop, the residue that exists on the walls or the surfaces they crawl across. And also looks like a little bit of rodent poop in there as well. And all these excrements are very toxic. And whenever you are around the house, even doing cleaning, trying to address it, it can become very toxic when breathed in by those who have lung conditions, especially with asthma.
Okay. So if you're definitely looking for an apartment and you might not see cockroaches, but you see that residue, then you might know that there's a, you know, maybe there have been cockroaches or a pest problem in that home.
Absolutely. And I know there's some guidance about this with the MTO documents, which is a great resource for utilizing when you're looking for a place to stay so that you're not really trapped into a lease for some of these apartments because you didn't see it in the beginning. So it's great, really great to have a plan when you're searching for a new place to move to as sort of a checklist. So when you're going into these places, you know what to look for, even as a potential tenant.
Yeah, yeah, great. So we're through the kitchen now, with lots of problems in the kitchen, and we start going into the bedrooms. And here, those are some of the things that again you see. So Madeline, I know you kind of already talked a little bit about the moldy carpet, but if there's anything else you'd like to add, and then also with the pets, you see that either there's a cat or dog in the home.
Well, I'm going to go ahead and start with our furry little friends that we just love to have around the home. Um, Not every pet is a heavy shedder, but most pets shed a lot. And then we have to think about the dandruff that's on the pets. Uh, um, we don't see it. It's not very visual, but it is dandruff that comes off, and that is also a trigger for a person with asthma. And we know about the molded carpet already.
Yeah, so definitely, if you're seeing this again, kind of getting into if you're a prospective tenant and you're seeing, these dirty carpets, it might not just be dirt, it could be something more severe. So again, we've already learned about how molds and the spores can be transmitted throughout the home, but definitely, really reconsidering if this is a prospective home that you're looking to live in and have your family be exposed to. So,
So we
Absolutely.
we would really suggest that we don't share our beds with our pets. We really, that's really not a good idea. No matter how much we love them, it's not a good idea for a person with asthma to sleep with their pets.
mhm. Yeah, thank you for adding that. That's a really good point. And I know too, um, at least often with cats, at least, even if you do decide to get rid of that cat, it can still take sometimes months for that dandruff that you were talking about to still stay in the home. So too, if you're moving into a place and you know that there were cats or dogs there, even if you don't have a pet, that's something to consider, because if you're allergic to cats and somebody would before you was living there and had a cat, that can still potentially flare up your asthma too.
Yes.
Okay, so also in the bedroom, we're seeing some blinds, but again, we're seeing kind of this red arrow is showing that there's this hole in the window seal or in the caulking. So what maybe concerns might we have there, Kim?
This moisture issue in this unit is just really extreme. There are gaps in the doors, gaps in the window caulking, and even in the picture before in the bedroom, you saw even the unleveling of the floor and how whatever water or moisture issues are there are affecting every area of this apartment, creating all these spaces for mold. When we're looking at things like this, when we're checking the windows, we're checking under the sinks, we're looking for those mold components because those are things that go unnoticed, but are one of the highest triggers for asthma. So when we see things like this, we start making a checklist of things we have to address in order to improve asthma, because this will continually be an issue even though you have the right medications in place.
Mm, Okay, and then we go again in the bedroom, we see this dirty vent. So I think you talked a little bit about earlier, Kim, about how, that could be definitely delivering, dust, but also molds. So how would maybe also somebody go about needing to clean those vents? Is that something they can do something about on their own, or is that something that they would need, help from a landlord to get cleaned out fully?
So if I would look at this at surface view, I would encourage it be cleaned with a vinegar and water solution because it sanitizes and disinfects the space using that products. People are concerned about the odor of vinegar, but once it dries, you never even know it was there. But it does help to address this and also mold accumulation. Now, I'm looking at this vent here, and there's a combination of things. You see excrement from pests, mice and roaches, and you see the dust that exists. So cleaning this is the beginning. But if we were to pull this off and there was a filter, we want to change that out so it doesn't blow that mold and dust and all these allergens around the house. But if it's something that's attached to the unit itself, then that is something we have to speak with the landlord about addressing. And
Great.
also to make sure that they wear gloves and a mask to do this
Mhm.
because we don't want any triggering while we're working to clean it up.
Yeah, yeah, really good point. And again, getting to the point that, again, if you haven't moved into the home or if you're looking for a home, again, checking underneath the kitchen sink, but looking at the vents and looking to see, are they well kept? Or are they looking like this, with mold and dust and such? So,
Yeah, I would even encourage you, like flushing the toilet to see if there are any leaks from the toilet or running the water to see if anything is actually happening visually while you're there. because those are things we don't do when we're going into places. We don't turn on the water, we don't flip the light switches, we don't flush the toilet. But if you are looking for a place to move, those are some of the steps that you should do. And again, are outlined in some great resources that MTO or the Metropolitan Tenants Organization does provide free of charge.
Yeah, great. Now, here in the home too, you briefly touched, like in the bedroom, we briefly touched about talking about pests. In the kitchen, looking at cockroach excrement, but here you're seeing maybe some mouse droppings you open the closet, you see some mouse droppings, and there's a mattress, and you're, also seeing bed bugs. I know we know that bed bugs themselves, may not be the biggest trigger of asthma, but I know too, again, what is used to get rid of them may be something that could be a trigger of asthma. So Madeline, do you want to comment on, again, if you're seeing these things, what things you might want to discuss with Jennifer, and if she's seeing this in her home?
Yes, the mice droppings, it's a big trigger. A lot of us do not realize that a mice or rat, they don't have a bladder. So as they're running around on your kitchen countertops, in your closet, they're study urinating. And the poop, and once it dries up, this is something that you're going to breathe in the air as well. So we need to really try to deal with this mouse issue. We might get some sticky traps or different traps, but we also want to make sure that we let the landlord know about this rodent problem, because this is really bad for a person with asthma. Bed bugs. I always itch whenever I see a picture that deals with anything with a bed bug. But the bed bugs are dangerous because we know that they come out and they bite. And they don't always, everybody think that not everybody, a lot of people think that you're gonna only find bed bugs on your bed. Bed bugs house almost anywhere in your home, the baseboards, different furnitures, and they go and they hide, and they could stay for over a year without having any contact with blood. So we use it's a powder that you get from Lowe's or Home Depot called diatomaceous herb, and you could put that there and put it on there, and it would help eliminate the problem with the bed bugs. Because one of the biggest mistakes that's made, if we find a bed bug or any signs of bed bugs, we go and we take our mattress and we go and throw our mattresses away, and that might not be where they're really housing it. It could be in a light socket. Like I have a footstool at the bottom of my bed. They could go there and rest until it's time for me to go to bed to come and attack for blood. So it is the things that we use to get rid of them that might trigger. Heat, excessive heat, that kills them. You let your landlord know, and the landlord is responsible. If we get an outbreak of bed bugs, it is the landlord's responsibility. So we try to treat it. If we can't treat it, then we should go and speak with the landlord.
Great, thank you. And so definitely, especially if you're looking for a place, again, kind of getting to that scenario, if you're looking for somewhere to live and it comes furnished, then definitely making sure you look at the mattress and the things, like you said, around the bedroom to see if you see any evidence of bed bugs. So if there are, that can be taken care of before you move in, as you were saying. So yeah, thank you for that information. Whoops, sorry. So I think we're done with the bedroom. Lots of problems in the bedroom too. And we go into the bathroom now. And so here we're starting to see, we see a lot of mildew growth So these are obviously, a few different pictures, maybe of different bathrooms as examples. And let me see. And then here's a few additional pictures of mildew growth. So Kim, I know you're the moisture queen over here as far as talking about how bad moisture is in this house, but can you tell us a little bit about what you're seeing here in the bathroom?
Yeah. This could be a common issue in anyone's home because a lot of times we get in the shower, we'll get out and we'll just, go about our day. And as we do this, this mold starts to accumulate because there's is your bathroom is not drying out or you're not giving it an opportunity to be moisture free once you complete your shower or it's not draining properly. Number one, uh, we would definitely want to address this and clean it up either using vinegar full strength by spraying it, letting it sit, then cleaning this up. And when we are in the bathroom showering, we're using a vent if it's in our bathroom. You know that annoying little sound you get when you turn on the fan in the bathroom, that is what we want to keep on while we're showering because it pulls the moisture out of there. And if there's a window in the bathroom, even opening that a bit to let that moisture escape. And after you've cleaned it and you've gotten rid of that mold, as a maintenance component, every time you get out of the shower, go ahead and spray the walls down with a vinegar and water solution. Let it dry because it deters mold growth. And don't be afraid to change your shower curtain liner because it will also attract that mold if we don't address it and it'll live there. Then every time we get in the shower, we activate it with this heated water. So we're actually breathing in mold as we're showering. So
Mm,
it's important that when we see it, we want to address it and clean it. And as a maintenance component, spray it down your shower walls with vinegar and water to deter any mold growth and change that shower curtain. Guys, look at the bottom of it. If it's showing any signs of darkening or discoloration, that is mold. Swap it out.
Thank you. And is that vinegar water solution usually a 1-to-1 solution? So 1 part vinegar, 1 part water that you were talking about?
That is accurate. And in areas like this, where in the corner it's really heavy mold, I would encourage it using it full strength to
Mhm.
address this extreme condition. And then going forward, that maintenance component is equal parts.
Great, thank you. Okay, now you look up too, and hopefully you can see this, is you see on the ceiling. So again, another thing to do is not always just be looking down, but also looking up to see if there's any damage on the ceiling. And you see a little bit of water damage on the ceiling. So again, I know we've been talking a lot about mold, but that's definitely a concern there for mold. So Madeline, any suggestions that you might have, or other notations from this slide that you would want to tell Jennifer about?
Okay, well, we, as Kim is the expert with the mold and moisture, but it's moisture that can cause mold and mildew. And another big problem, if it continues, the ceiling could fall down and injure somebody in the home, and that would be another issue right there.
Yeah, thank you for bringing that up. And that might be water damage, could be from the bathroom itself, but if we're not using a fan, but it could be from the upstairs neighbor too, right? So just thinking about that. So I think usually when you're seeing this type of water damage, it's best to contact, if you're a tenant, contact the landlord about getting that for safety purposes, both with the mold exposure, but also structurally, as you pointed out. Okay, so we're done with the upstairs of the house, and now we're going to go into the basement. And here, this is kind of what you see, Kim. So what are you, what kind of concerns do you have here?
Oh, I would say, Jennifer, I see why you have a rodent issue because now there's no caulking around these pipes. Rodents can come in from outside or other pests can come in from outside, and wherever there's moisture, you're going to attack all kind of bugs, especially roaches, maybe water bugs and things of that nature. But there has been some uh, inappropriate maintenance to these areas, like they were not done professionally. So a reoccurrence of moisture or rodents coming in is going to be inevitable because the right steps were not taken. I would really, really strongly encourage Jennifer to let's start seeking maybe a different space to live, because there's some structural things happening in this unit that will constantly affect her, because sometimes landlords take the easier way out, which is financially better for them, but not really what's necessary for the appropriate eradication of mold or rodents from an apartment or a home. So I would I would say this is where they're coming in, and I would want to try to address this as well, because this will get at the core of where some of these things were happening.
Okay, great. So now we're going to go to outside the home. So again, a lot of times when we are looking for a place to live, or even just thinking about things that might be in the home environment that might be triggering our asthma symptoms, we forget about outside the home. So some of the things that you might see outside the home that might be concerning. So you're seeing here, first of all, you see an air conditioner. And there's goods and bads to that, but and then also in the brick, in the outdoor brick, you're seeing gaps. So what things should somebody be concerned about with these two things, seeing those two things?
Okay, with the air conditioner should be treated once a year. So it needs to be clean because some of those toxins could be coming in through and going into the house. So you're breathing in whatever there, whatever is collected inside the air conditioner. That gap in the outside brick is like a welcoming sign to rodents, because they could travel through there and enter your home from that way. So this needs to be corrected. And also, and Kim mentioned it before, you have these gaps, and in the wintertime, the cold could come in, and the cold is a trigger. So this really needs to be fixed so we can keep the little four-legged friends out.
Okay, well, great. Anything else to add, Kim, to this? It's our
Well, I
last
think I
slide.
think Madeline really addressed it well. And again, structurally, this unit is something that even if you were to try to mitigate some of this on your own as a tenant, you can also utilize 311 to inform them of needing this to be baited because of the rodent problem that's existing maybe in your neighborhood or around the property, and 311 will come out and put out rodent bait traps for this to try to address it. But definitely is something that you want to notify the landlord about. And what I also just wanted to refer back to, even when it was with the mold or the rodents or the bed bugs, there's some stigma that comes along with this that really prevents our tenants from even wanting to talk about it, because there's a bit of shame that comes along with it, which allows these conditions to really get more and more extreme. So we also try to encourage people to say, as soon as you see it, just say something about it so it can get addressed, so it's not a larger issue at the end of this. So those are also some of the things that come along with looking at all these things, is the stigma that comes along with it. People may be perceived as not the best housekeeper, or not uh, doing the best that they can to address some of the asthma issues in their apartment or in their unit.
Okay, well, great. Well, we definitely want to thank you for doing the walkthrough through Jennifer's home. And obviously, as we talked about, there's definitely a lot of areas for concern, but definitely having your guys' input so she can get a better handle on her asthma as well as her kids' asthma. I know Kim mentioned several times throughout our video today is there's a checklist, a home environment checklist that was developed by the Chicago Asthma Consortium as well as the Metropolitan Tenants Organization, and that is available on the Chicago Asthma website, which is under for resources. It's just www.chicagoasthma.org. And as Kim said, it's free. You can go there, print it, or just keep it on your phone and look through it, and utilize that. Even if you have concerns about maybe what might be going on in your home, as well as there are some tips on how to remediate, but also a lot of tips if you need help as a tenant living in Chicago and you need some information about how to work with your landlord to get those issues remedied. You could definitely contact MTO at their hotline at 773-292-4988. And that is open and staffed Monday through Friday from 1 to 5 p.m. So again, I wanted to give a big thank you to our community health workers from the Sinai Urban Health Institute, Madeline and Kim, for your time today and sharing your expertise and knowledge about the home environment and asthma. We hope to see you at our next Ask the Expert video. Thank you.